Opportunity to keep our fellow citizens updated regarding developments in the province, especially developments pertaining to the COVID-19 pandemic. As we all know, this is one pandemic that has changed our lives in a most profound way. Before we get to the business of the day, there has been a number of interesting developments in the past week that we will appreciate to share with you today. Firstly, as the province of KwaZulu-Natal, we welcome the announcement by President, His Excellency President Ramaphosa, that this year's local government elections will be held on the 27th of October 2021. This has put an end to much speculations and widespread concerns over whether the elections were going to take place at all, given the massive disruption caused by COVID-19 pandemic. These local government elections will also mark the 21st anniversary since the establishment of a local government system in our country. And this will be the 21st anniversary. The upcoming local government are important as they represent the maturity of our democracy. As the province, we will use the upcoming period to reflect on the journey and the progress made in improving the landscape of where our people live. We will identify areas where corrections are required and use the accelerated district development model to address our citizens' concerns. It is extremely important that as many eligible citizens as possible participate in this all-important process. Another development related to the Freedom Day celebration. We are looking forward to commemorating the 27th anniversary of the country's first democratic elections in 2 days' time. In this regard, we will be hosting our own Provincial Freedom Day celebration at Uhlange Institute on Tuesday, 27th April. This year, we will be remembering Mayor Charlotte Maxeke and Dr. John Langalibalele Dube, both of whom would have turned 150 years this year. This is a generation that planted the seed that have germinated into freedom that we are enjoying today. Although some challenges still do exist, we certainly have a lot to celebrate and not to take for granted as a nation, particularly our socio-political freedom, which was achieved through the sweat and blood of many heroes and heroines of the people of South Africa. The official gathering to celebrate the Freedom Day will be held in strict adherence to COVID-19 regulations. With regard to the update on COVID-19 status quo, the province of KwaZulu-Natal continues to rank the second highest in terms of the number of laboratory confirmed cases countrywide, contributing 21% of cases. The average number of cases recorded in the past 7 days declined to below 100 cases per day. The province continues to rank the fourth highest in terms of fatalities countrywide, following Eastern Cape, Gauteng, and Western Cape. We have continued to observe a decline in number of new cases recorded weekly. The overall percentage change in number of new cases between week 15 and 16 was a decline of 8%. The actual number of new cases was 606 for week 15 and 555 for week 16 respectively. The overall provincial incident risk remained at 5 cases per 100,000 population. However, King Cetshwayo and Hirigwala, as well as Uthukela districts, observed an increase in the number of new cases. In fact, King Cetshwayo and Hirigwala districts observed a percentage change of more than 50% in the past week, which is a concern for all of us. The number of hospital admissions has continued to decline, in keeping with a reduction in the number of new cases. The province currently has 444 COVID-19 patients admitted in hospital, with a recovery rate of 96%. With regard to the vaccination program, the Sisonke Johnson & Johnson study, also known as Phase 1A, will resume soon and is expected to end on the 30th of April 2021. Phase 1B will commence on the 1st of May 2021 and end on the 16th of May. Since Phase 1A of the vaccination process began on the 18th of February and until its voluntary suspension on the 12th of April, the province of KwaZulu-Natal had vaccinated a total of 51,615 health workers at 91 sites throughout the province. This was made up of 37,457 health workers from the public sector and the remaining 14,158 from the private sector. As part of Phase 1B, if the adequate number of vaccines is received to vaccinate the remaining 81,238 public health care workers over 7 days, we could meet a provincial daily target of 11,605 workers. Vaccination for Phase 1B and Phase 2 will run simultaneously. For instance, we will be vaccinating essential workers aged 40 and above, and at the same time as we vaccinate people in congregant settings and those with comorbidities or those who are aged 18 years and above. An incremental approach will be used when dealing with Phase 2 and Phase 3, with the number of vaccination sites getting increased as the program is scaled up. The KwaZulu-Natal Department of Health has already identified mass vaccination centers such as the Royal Showground for Umgungundlovu district. For eThekwini, we have so far identified Pinetown Civic Center, Kings Wellington Sport Ground, and Ketomena Sport Grounds for the South Central. Hospitals and community health centers will act as primary vaccination centers, while clinics and other community structures will be the secondary vaccination centers. The community structures that will be utilized as vaccination centers have been mapped per district, and all information in this regard will be made available. With a provincial daily target of 30,000 vaccination for at least 5 days per week, the Phase 2 vaccination could be completed by September 2021. This will create an opportunity for us to commence Phase 3 earlier in October 2021. Phase 2 of vaccination process will then start on the 17th, as we indicate, and will cover essential workers, people who work in settings where they interact with a high number of members of public, those who are over 60 years, and those who are with comorbidities. Our target for phase 2 is to vaccinate at least 2.9 million by October of this year, with phase 3 expected then to begin in November. We have an army of 7,616 people who are trained to carry out these vaccinations, and we are confident that with the requisite support and cooperation from the public, we can indeed achieve these targets. We have outlined the table here, which we will provide in our statement, and the table covers the workers that are targeted or are a target between May and October, and then it deals with all categories as I've already unpacked. We want to emphasize the importance of registering for vaccination. The success of our vaccination plan, which will help us to achieve enough population immunity to be able to halt the spread of the virus, depend critically on as many people as possible getting registered on the electronic vaccination data system. We understand the dynamics of our province, and that many who are 60 and above will require hands-on support to get registered. We are urging relatives, children, and friends of the elderly who have familiarity with technology systems to assist our grandmothers and grandfathers. Ogogo nomkhulu masibalekelele ukuthi ba-register. As the province of KwaZulu-Natal, we are directing that the coming weekend be the weekend of heightened registration for vaccination. To this end, we will be visiting various districts where we are champions to monitor and assist in the registration of the elderly, especially as the critical contingent. The self-registration system for people above 60 years is now live since the 16th of April. Those that cannot self-register will need to be supported, and in this regard, the department will utilize all municipal offices to register. But we will also use mobile clinics, school health teams, community health workers, community development workers, agricultural extension officers, environmental health practitioners, traditional council secretaries, and other categories of workers will assist in registering community members as part of support to the vaccination program at the district and local levels. Training material on the electronic vaccination program include a tutorial video that has been circulated to district, and staff training commenced as well on the 19th of April. We are quite concerned about complacence. We've noted with a great sense of worry various forms of behavior that indicate a high level of complacence, especially when it comes to adherence to COVID-19 safety precautions. Far too many people seem to have lowered their guard. They are no longer wearing their mask in public, and many are carrying themselves they carry masks for just compliance. There is no social distancing, let alone regular hand sanitization or washing of hands with water and soap. People are gathering in large groups, especially at restaurants, pubs, nightclubs, and taverns. Some shops are even allowing more people than required numbers, while others seemingly don't bother to have hand sanitizers at the door. The curfew times are also no longer being respected in some instances. We seem to be sliding back to the kind of complacence that consumed us toward the end of last year, just before the second wave came and ambushed us. We plead with the citizens of the province to remember that once bitten, twice shy. As it happened with the second wave, the third wave will not announce its arrival. Yes, the numbers may be low at a moment, but COVID-19 is still with us and is killing the people. As of today, the province of KwaZulu-Natal has recorded 10,369 deaths since COVID-19 started. We remain concerned that our province continues to rank the fourth highest in terms of fatalities countrywide. The Department of Health is monitoring the resurgence indicators, which will alert the province to respond accordingly if there are spikes or signs of a resurgence of COVID-19 in the province. If we are to avoid the calamity that we saw in December and January, we must start today and behave as though the third wave is already here. It is not enough to think that because you know and trust someone, then they are not infectious. It just does not work like that, and we have seen so. So we continue to see these challenges, and let us also take lessons of what is happening in other countries. As we speak, the subcontinent of India is in deep trouble due to a resurgence of COVID-19. We are seeing in other countries people are scrambling for life-saving oxygen supplies, beds, and medical drugs. Patients are dying outside hospitals. On Friday, we observed in India that the country's overnight infection total was higher than ever recorded anywhere in the world since the beginning of the pandemic last year, and it was at 332,780. And that tells you the increase they are facing now. In Japan, the central government has declared a third state of emergency due to COVID-19 pandemic, with new restrictions imposed in Tokyo, Osaka, and other places due to a sharp rise in new COVID-19 cases. We pray for our fellow brothers and sisters in these countries, but also for our fellow citizens battling COVID-19 in our own country. If we continue carrying on as if it is business as usual, then we might have soon be in deep crisis and then regret. We must do all what is possible to avert the third wave. We will be conducting surprise visits and check levels of compliance in various areas. We will not hesitate to revoke trading licenses and take legal actions where transgressions are found. In terms of, as we conclude, we would like to update you on progress regarding efforts of our provincial government to return the body of the late Mr. Lindani Mini to the country. Early this week, we sent a delegation led by the Director General of KwaZulu-Natal, Dr. Nonhlanhla Mkhize, to Empangeni to meet with the family of Mr. Mini. As the province, we are saddened that one of our own have been caught up in the ongoing spark of attack by law enforcement authorities, which are apparently targeted at black people in the United States. The objection behavior should be condemned. Investigation must be thoroughly conducted and no stone must be left unturned. Justice must be served in this case. As the provincial government, we are in regular contact with the Mieni family, as well as the Department of International Relations and Cooperation, and the Consular General in US regarding the development in the case, as well as plan to ultimately have Mr. Mieni's mortal remains repatriated to his home country. On Friday, 23rd of April, the Consular General in Miami, who is responsible for OHIO state, indicated that the American government has released the mortal remains of Mr. Mieni to his wife, and they are being stored at the local funeral parlor. On Saturday, 24th of April, the office of the Premier had another meeting with the family at Richards Bay to discuss progress as well as the way forward. The family reported the following. Working together and supporting the family, the body of Mr. Mieni will depart US on Tuesday, 27th April 2021. It will arrive in South Africa OR Tambo International Airport on Friday, 30th April. More details, including confirming funeral dates and memorial services, will be communicated by the family, supported by the provincial government in due course. We wish to once again appreciate the support that the Department of International Relations, through the Consul General, is giving to the Mieni family and to us as the government to ensure that we handle this situation with care. With that, I wish to thank all of you. Thank you.
Thank you very much, Honorable Premier. We'll go straight to questions. We'll start with the colleagues that are present here in this room, and then we will from my colleague Agiza and Tammy, the colleagues that are on the online platforms, if there are any questions they're asking. I'm noting the first hand here. My sister, the second. Is there any other hand inside the room? Okay, let's start with the two.
Thank you. Bong Mafulana from Museum Africa. Premier, I want to understand, in terms of warning against a third wave and the behaviors, what have we learned from the previous, first wave, the second wave, that we can do differently to ensure that the numbers don't increase exponentially, concerning the fact that KZN does have some of the highest numbers in the country too? It's not the highest, but it ranks in the top 3, I think. And for you, MEC Nomagu, when it comes to the rollout of the second phase of the vaccine, how much of that depends on us getting the vaccine from national on those plans, and how much depends on those plans being rolled out because the vaccine is already here? Thank you.
Okay.
Hello.
Yeah, we can hear you.
Can you
We
hear
can
me?
hear your voice.
Oh, okay, thank you. To Honorable Premier, I heard you mention the vaccination areas in Pietermaritzburg and in Durban. And I just want to check, what about the other areas in the province? And then my second question is, how many vaccines are we expecting to receive in KZN within the second phase? Thank you.
Okay, thank you. Can you request the Honorable Premier and the MC to respond?
Well, I think I'll take the first question and leave all others to the MEC. Firstly, I think this is a virus that is not easy to predict. And that lesson we got at the beginning of November, December last year. You will remember that we were thinking that the second wave will be around mid-December. But just the beginning of November, we were already facing the second wave. And therefore, that's a serious lesson. But also, what we're emphasizing today, complacent. I think complacence is one of the issues that keep affecting us as the society. We normally take things for granted and think that because you can't see that this person is infected, think that no, people are just not infectious. And that then caught with us. And that requires that we strictly comply with measures that have been put in place to prevent the spread of COVID-19. We are grateful to various partners who continue to support in messages and ensure that they educate the society and emphasize that we must still continue to adhere to COVID-19 regulations. Thanks. The MEC will proceed with other issues.
Good afternoon, ladies and gentlemen. Good afternoon to the Premier. Thank you very much for the questions. Bonga, Premier has responded to your questions, and I think it is exactly as he has indicated. But I also just wanted to add that as a result of that, what we have learned now as a department from the first and the second wave is that while we have always said we are ready, some of our facilities, between the first and the second wave, we dismantled them because we thought we will have enough time to prepare like we did during the first wave, only to find that we actually didn't when the second wave came. As a result, we have now decided, particularly the field hospitals, we have decided not to dismantle them. As a result, in between the second wave and the third wave, if it comes, we will be utilizing those for different health-related issues. Premier gave an example of the fact that the Royal Showgrounds, for instance, is one of our field hospitals. We are not dismantling it, but we will be utilizing it for inoculation during the vaccination period, because we were in any case going to need bigger centers to vaccinate communities. So that is what we are going to do. But in the meantime, while we are waiting for the vaccines to come, we continue to use the Royal Showgrounds for other health-related matters, and we are able to put patients there that don't need as much attention as they would need in a hospital. And we are doing the same thing with all the other field hospitals that we have. The one that is in Clearwood, we have decided to move some wards from Mahatma Gandhi because those wards need to be renovated. So instead of just turning away patients, we have then moved those patients to the field hospital in Clearwood. The one that is in General Kizanga Hospital continues to be used just as a field hospital. So one of the things that we've really learned is not to dismantle our structure, our infrastructure, because when the second wave came, it didn't give us warning. It just came overnight, and we had to now start scrambling again. We've also made sure that the health workers that are on contract, we request the Premier to extend their contracts for another 6 months, and that has happened. Their contracts were extended from April to, I think, September. That is part of us planning, so that when the next wave hits us, we don't start and recall them and say, come back, we need you. So we have learned a lot from the first wave and the second wave, and in terms of our systems on the ground, we made sure that we maintain and we keep those systems as they are. But in terms of behavior, it's exactly what the Premier is indicating, that our people really just became complacent and thought that COVID-19 is gone, which is why wherever we go, although we say numbers are very low, for instance, today we have 82 infections in the province. We had 102, I think, yesterday. We had 71 the day before that. That on its own, the fact that there is that fluctuation should be an indication to our people that the virus is still with us, and it should make everyone worried, and it should make all of us to take all the precautions that needs to be taken. So I thought let me just add that infrastructure part of it. Our plans in terms of dates in relation to vaccine, are we going to be able to implement them to the T according to the dates we have given? Those plans and those dates are according to our own infrastructure, our own systems as a province, but they depend on the number of vaccines that we get from national. So national will receive a particular number of vaccinations and then distribute them to the whole country. To give you an example, with the phase 1A, the first batch of J&J, we received 10,800. Sorry, we received, as a province, we received 10,800 when the country had received 80,000. With the second batch, as a province, again, we received 15,000 doses when the first batch was 80,000 that was received in the country. We were able to receive a bit more because we finished the first 10,000 quicker than other provinces, and the national realized that they needed to give us more. Having said that, on those batches that we have been given, we were expected to share with the private sector. So the 8,500 that we initially received, 30% of that had to go to the private sector. With the 15,000 that we received on the second batch, another 30% went to the private sector, because that is the agreement between government and the private sector. So how we roll out will depend on how many doses national receives and how soon are they sent to us. I must, however, indicate and appreciate the fact that national has not delayed at all. Every time every time they receive batches, we get them a day or so later, and therefore that had made it easier for us to be able to go to the rural areas and be able to vaccinate our health workers as we should. So yes, we do have our timelines, but our timelines depend on when we receive the doses from national. But I'm saying in the past, national has not been delaying us. They've been able to give us those on time. So we hope that the same is going to happen this time around. Sihle, you were asking why Premier is just mentioning areas in the urban centers. We are certainly going to be vaccinating throughout the whole province. And in the whole province, we will be looking at community centers, your halls. You will be looking at indawo zamakhosi. For instance, you heard the Premier speaking that onobhala bamakhosi are going to be requested to assist the elderly as well in ensuring that they register on the EVDS system. So in every municipality, in every ward, we are going to have a structure that we are going to put up. Where we don't have a clinic, we will be using a community hall, because the process of vaccination it might not be very long, but there is also a time where a patient must sit for about 30 minutes so that they are observed to see whether they are not reacting adversely to the vaccination. So we do kind of need bigger venues. So where we are unable to get halls in the municipalities or in the wards, we might be forced to put up marquees, but that is a system that we are working on. So this is something that is going to go on for quite a while. The reason why we have only mentioned the areas that we mentioned, we were using those as examples so that we indicate that that's what we are going to use. When you go to Emajuba district, for instance, they've got a big center that they used to use as a sports facility, and that's the center we are going to use. But that center is in a different part of town. So when we get into the rural part of Emajuba, we'll then have to start using community halls. We will not be able to mention all of them right now, because each and every district will have its own hall. What we will do as a Department of Health, as we did when COVID-19, probably on a weekly basis, we will issue an indication on which venues are being utilized for that particular district. Now, as soon as the vaccination starts and we are able to get to those facilities, that is what we are going to do, because it's important for our communities to know where to go. That is something that we will always have to do. At least once a week, we will indicate that Emajuba district, these are the community halls where you are going to find your health workers who are going to vaccinate. When you go to Zululand, these are the community halls. And remember, we are talking about Zululand as a district, but it has different municipalities. So we'll have to break all of that down moving forward once we've been able to get the vaccinations. How many vaccines are we going to get? That will depend on how many vaccines National gets. Because National will get the vaccines and then they will divide them according to the provinces. Right now we are expecting vaccines or doses from Johnson & Johnson. We are expecting about 1 million and above from Pfizer. The minister is talking to other pharmaceutical companies. The minister is talking to Russia about the Sputnik vaccine as well. He's talking to Cuba about what they are utilizing. So this is going to be an ongoing and a shifting target depending on how many vaccines we get on an ongoing basis. We have found it a bit difficult because the rich countries, particularly your European and your US countries, have I don't want to say hog, but have wanted to vaccinate their people first before they can give vaccines to other countries, and which is why we are finding it difficult, or we are getting the vaccines in a slower pace than we would have ordinarily expected. So those are the vaccines that we are going to get. Maybe now that I have an opportunity, I also need to explain the issue of the Johnson & Johnson and the Pfizer vaccines and how we are going to utilize them. Pfizer vaccine, the J&J Johnson & Johnson vaccine is a one-dose vaccination, which means you come in, you get vaccinated once, and that's it. But the Pfizer vaccine is a 2-dose vaccination. You then need to go back. You get vaccinated on the first day. You are told that after 6 weeks or so, you must come back and get vaccinated. Now, we have decided as this province that the Pfizer vaccine in particular, we will utilize it in the urban centers, because we think in the urban centers it is easy for our communities to access, or it will be easy for our communities to access the vaccination points, rather than in rural areas where people sometimes have to travel about 50 kilometers or so to get to a center. So our Johnson & Johnson will be in the rural centers. The Pfizer vaccine will be utilized in what we deem as urban centers, where it's easier for people to travel. But the other reason why we've decided to utilize Pfizer in the urban centers, it's because of the kind of refrigeration that is needed by the Pfizer vaccine. It requires a refrigeration system that is not in all our facilities. It is only in certain centers, and in those centers, and it's not a lot of them in the province that we have, but we will be able to transport them on a daily basis to centers. For instance, it's easy to transport a vaccine or doses from eThekwini to General Gizenga hospital or Ilembe district, because it's closer. It's also easy to transport the dosages from Umgungundlovu to Ladysmith, because it's not very far. But the other centers, then we are going to make sure that they get the Johnson & Johnson. I want to explain this because I don't want our communities to be confused when someone is told to come back again for a second dose and they say, no, but my grandmother in Umkanyagute only vaccinated once, why must I come back again, and therefore don't come? So that our people understand that we are using two different dosages. In urban centers, you might be required to come back twice because we would have been using a different one, and those in rural areas will use the one dose kind of vaccination. Thank you very much.
Thank you very much, RMC. I see no indication. May I invite the Honourable Premier to summarize for us in Zulu?
masibingelele kunina nonke. Sibonge again ukuthola ithuba lokuthi sikwazi ukunikezela ngolwazi ngezinto eziqhubekayo kwiprovince yaKwaZulu-Natal. Isikakhulukazi ngokuthi senze njani ukuqhubeka nokulwa nalolu bhubhane esibhekene nalo njengesizwe nanjengeKwaZulu-Natal. Mhlambe manje singene ngokujulile kudaba lwe-COVID-19. Kunama developments enzekile kulezi insuku ezivela kuzo kungaba kuhle ukuphawula. Siyafisa uqala ngokubonga ukuthi umongameli ulithulile usuku lokhetho, ukhetho lomasipala, lokhu oqede uqagela nemibuzo eminingi ukuthi ngakube ukhetho luzoqhubeka noma cha. Siyazi futhi ukuthi lolu khetho luzomaka i-anniversary yama-21 since kwabakhona i-system ye-local government eSouth Africa. Kubaluleke kakhulu ukuthi sonke sibambe iqhaza okhethweni lomasipala, uqinisekise ukuthi sigxilisa intando yeningi nokuthi futhi siyakwazi ukukhetha abantu abazosimela basikhulumele siyimphakathi. Siyazi ukuthi leli thuba elisele libiza ukuthi siqinise ukuletha intuthuko, ingakho sisebenzisana nomasipala ukubheka izikhalo ezikhona, siqinise ukuthi siyabalekelela la okufanele khona. Kuleli sonke siyakulo iKwaZulu-Natal neSouth Africa yonke izogubha iminyaka engamashumi-27, 27 years. ISouth Africa yathola intando yeningi. NjengeKwaZulu-Natal sizoba ingxenye yokugubha lolu suku. Sizoligubha lolu suku sikhumbula impilo nomzabalazo kamama uCharlotte Maxeke nobaba uDr John Langalibalele Dube. Bobabili ebebeyobe behlanganiswa 150 years kulonyaka uma bebesaphila. Sizoba lapha Ohlange Institute uqinisekisa ukuthi silandela kuma footsteps ka former president uNelson Mandela ngesikhathi evota ngomhla ka 27 April. Siyafisa futhi uqinisekisa ukuthi lo umgubho sizowenza ngaphansi kokulandela yonke imiyalelo nemithetho yokuzivikela kwi-COVID-19. Uma sesibheka kwi-COVID-19, iKwaZulu-Natal yaqhubeka iba ngeyesine kuma provinces affected ngenxa yokushona kwabantu nge-COVID-19. Silandela kwi-Eastern Cape, Gauteng ne-Western Cape. Kanti in terms of izinamba singabe sibili silandela kwi-Gauteng, and KwaZulu-Natal contributor 21% of ama-cases amasha. Sibonile ukuthi kumasonto adlule kube ne-decline elethe elikhulu ithemba yokwehla kokutheleleka kwabantu kusukela kwisonto lika-15 la oyinamba zehle khona from u-606 kanti isonto lika-16 iy'namba zaba u-555. Noma kunjalo siyanothisa ukuthi amanye ama-district afana noKingcitshwayo, iHerigwala noThukela abaney'namba ey'thusayo eziyaphezulu, isikakhulukazi Kingcitshwayo neHerigwala. Siyafisa ukuthi sonke sazi ukuthi i-COVID-19 isekhona futhi iyingozi iyabulala. Kumanje abantu abasezibhedlela ngenxa ye-COVID-19 bangu-444, okusho ukudecrease kwabantu abaseyibhedlela. And siyabonga ukuthi recovery rate yethu iwu-96%, okubonakalayo ibuyela phezulu. Sizoqhubeka nokuqinisa ukugonywa, and siyafisa ukuthi sigcizelele ukuthi asingabi nongabazane kepha masiqhubekele ukuthi sonke siba ingxenye yokugonywa. Phase 1A uzoqala and ulindele ukuthi uphele ngomhla ka-30 April. Emva kwalokho kuyobe sengena phase 1B and lokho okubili lama phases omabili abhekele ekutheni si vaccinate abasebenzi bakahulumeni abase zikhungweni zezempilo. Phase 2 uzoqala uhambisana no phase 1B and lowo uyobheka ekutheni vaccinate abasebenzi abasendaweni lezo ezomphakathi nabaxhumana nemphakathi isikhathi nesikhathi. Emva kwalokho siyoba no phase 2 no 3, phase 3 ozovulela ukuvaccinate kubantu bonke and indawo la abantu bezovaccinatwa khona ngokuningi already sezihlonziwe. Ngingasho nje ukuthi eMgungundlovu siyosebenzisa iRoyal Showground. eThekwini ziningi indawo ezihlonziwe ezifana noPinetown Civic Center, Kingswell Sport Ground, Kettle Manor Sport Ground nezinye. Kuyo yonke KwaZulu-Natal sizosebenzisa izibhedlela nama-community health centers uqinisekisa ukuthi abantu bayavaccinate. Uma iqala le phase silindele ukuthi sivaccinate ongenani abantu abangu-30,000 ey'nsukwini esikhathini sesonto sivaccinate not less than 30,000 ukuze siqinisekise ukuthi le phase iyaphela ngoSeptember. Si-aime ukuthi ngo-October sibe sesivaccinate abantu abangu-2.9 million. Sinabantu abazosilekelela abangu-7,616 abaqeqeshiwe abavela ey'khungweni ey'hlukahlukene. Siyafisa ukugcizelela ukuthi kubalulekile ukuthi abantu barejiste bakwazi ukuvaccinate. Siyazi ukuthi KwaZulu-Natal ngenxa yesimo sokuthi akubona bonke abantu abakwazi ukuthola ezobuchwepheshe, especially abantu abadala. Kumeleke thina esikwazi ukusebenzisa ama-cellphone nokunye sibalekelele ukuthi barejiste. Leli sonto lempela sonto esiya kuyo kumele siyisebenzise ukurejista abantu abaningi abafisa ukuvaccinate. Sizosebenzisa izikhungo zikahulumeni, especially ama-ofisi omasipala, ama-mobile clinics, sibambisane kusetshenzwe through ama-community healthcare workers, community development workers nabo bonke abasebenzi bakahulumeni uqinisekisa ukuthi abantu bayabhaliswa. Enye yezinto esiphatha kabi ukubona abantu bakithi behlisa izinga lokuzivikela kwi-COVID-19. Ey'ndaweni ey'ningi zomphakathi sibona abantu bengawafaki ama-mask, abanye bawaphathe nje for the sake of ukuwaphatha, abanye bawafake i-living. Kusiphatha kabi futhi ukubona abantu bengayenzi social distancing la kumele benze khona i-social distancing. Kwezinye indawo abayiwashi izandla and abawasebenzisa ama-sanitizers. Siyafisa ukugcizelela nasey'khungweni ney'tolo uthola ukuthi kwezinye indawo uyangena ayikho i-sanitizer emnyango. Sizoqinisekisa ukumonitha ukusebenza kwey'ndawo zomphakathi ngokwenza ama-surprise visit kuzo zonke iy'ndawo zomphakathi. Kubalulekile ukuthi sifunde kwesikubonile singaphindwa isimo esisehlele ngoDisemba noJanuwari. Siyabona futhi amazwe amaningi afana no-India no-Japan already ba-affecteka kakhulu ngenxa ye-second wave, ye-third wave rather. And kumele sizivikele, singathathi ngokuthi ngoba iy'namba ziphansi sesiphumile engozini. Asithathe leli thuba njengoba siphetha ukugcizelela ukuzwakalisa ukuzwelana nomndeni kababa umfowethu uLindani Mini obulewe ngamaphoyisa e-United States. Kuleli sonto esivela kulo siye sacela uDirector General uDr. Nonhlanhla Mkhize ukuthi avezithe umndeni akwazi ukuxoxisana nomndeni. Siseyinhlelweni zokubambisana nomndeni umnyango we-International Relations and Cooperation ne-Consular General Office sikuqinisekisa ukuthi umzimba kababa uLindani Mini uyabuya. Sihlele ukuthi asuswe ngoLwesibili lomhla ka-27 umzimba wakhe ubuyiswe usuke e-United States ufike e-OR Tambo Airport ngomhla ka-30. Sizoqinisekisa ukuthi sinikezela ngeminyaka imininingwane e-relator kuma-memorial services no daba lomngcwabo. Sizonikezela imininingwane ngokubambisana nefamily uma isikhathi siqhubeka. Siyabonga.
Thank you very much, Honorable Premier, MEC, and colleagues from the media. We've come to the end of it. We'll keep the colleagues abreast about all these developments and issues that the Premier has raised today. We are adjourning. Thank you.
Thank you.
Okay,